Everybody knows that smoking in general is super bad for your health, but it's even worse in respect to surgery outcomes. Specifically for hernia surgery, it means higher chance of hernia coming back afterwards and higher chance of having a wound infection after surgery. So if you go see a hernia surgeon and you're actively smoking, most of the time that surgeon is going to tell you you can't have your hernia fixed until you stop smoking. The reason why is mostly due to the fact that smoking cigarettes through a number of mechanisms decreases the amount of oxygen that can be delivered to your tissues that are trying to heal after surgery. And this is true of any nicotine containing substance, including vaping. So how much does smoking actually increase your surgical risk for hernia surgery? Let's dig into it. This is a meta-analysis that looked at 42 studies that compared smokers and non-smokers in respect to their hernia outcomes, specifically the chance of the hernia recurrence or chance of having a wound infection. Overall, it showed you had an increased chance of getting a wound infection and hernia recurrence when you smoke for both groin hernias and ventral abdominal wall hernias. But as with most medical literature, the devil is in the details, so let's look into it. The study showed that for ventral hernias, smokers had a chance of hernia coming back of 10%, compare that to non-smokers had a hernia recurrence chance of 9%. Similarly, the surgical site infection was around 7% in smokers and 4% in non-smokers. And these results were statistically significant with a p-value less than 0.05. What the study didn't do was do a deep dive into how these risk factors were stratified by the type of hernia and the type of patient. For example, didn't stratify much with size of hernia and whether or not the hernia repair was done with small incisions or with a large incision. So as with most medical literature, you can sort of bend the results to match what you want. In my practice, I take that as I try to encourage every patient who's having a hernia surgery to stop smoking because it's best for them as a person. So for patients who are very high risk for hernia repair, whether it be a very large hernia, poorly controlled diabetes, high BMI, hernias that have already come back multiple times, it is the right thing to have these patients stop smoking before surgery because they really only have one more good shot to get this right. But for patients who have relatively small hernias who don't have a ton of other risk factors besides smoking, they're very symptomatic, they've already tried to stop multiple times and they just can't quit smoking for whatever reason. If the patient is okay with this slightly increased chance risk of having a wound infection and hernia recurrence after discussing this literature, I think it's the right thing to do for that person to offer surgery.